ladies and gentlemen, I think over the past couple of weeks, there has been a lot of changes in terms of the vaccination landscape. What has been going on is that we have seen most of our frontliners already having received vaccination, but what we start seeing is something called breakthrough infections, which is, I think, an area which has been raised over the media last week, quite a bit of concern over that. And we're also kind of mopping up in terms of finishing up the vaccination of the rest of our frontliners. And now the questions that are arising within our mind is whether, what do we do? Are we now okay to change practices? Do we now go back to doing what we were doing before pre-COVID? So, which is why we've had all these queries come to us, and we're very privileged to be able to get our consultants to kind of provide some input on that for all of us to kind of derive insights together on. So first up this afternoon, I would actually like to get Dr. Leong on board, and Dr. Leong is going to speak to us a little bit about his perspective, give you kind of the clinical picture on healthcare workers and COVID-19 vaccination. How do we go forward? So please allow me to turn the stage over to Dr. Leong and get Dr. Leong to share his screen if he's going to.
Yeah, thanks, Dr. Murali. Can you all hear me?
Yes, we can, Doctor.
Yeah.
Clear.
Okay, thanks, Dr. Murali, for your kind introduction. Yeah, I have a short chat with Dr. Murali before this, and I know I'm just sharing my view and my thoughts on the vaccination and healthcare worker. There is a lot of evolution, things are going on, and there are some uncertainties still. So I just share with you all that with this, my experience on all this vaccination and also airborne diseases, I can say, is starting from this. I faced an influenza outbreak in our female psychiatry ward in Hospital Kuala Lumpur in the year of 2016. Okay, this is my first encounter on having problem. I'm learning from this starting. Having influenza outbreak in psychiatry ward in Hospital Kuala Lumpur in 2016. And now we are having coronavirus. And on and off, we do have a patient who are having pneumonia or influenza-like SARS-like syndrome admitted to our ward. And then we do COVID tests. It turned up to be positive. It creates some minor outbreak in the ward, or in fact a healthcare worker ourselves who probably get it from community and then come into work without knowing, and all this can cause some small outbreak. So when there is an outbreak in the ward, it's actually quite depressing. I'll tell my experience in 2016 when this happened, and I need my psychiatrist asked me to help. Initially, when there is more and more people with fever and influenza-like illness getting ill, the first thing alert us during that outbreak is because we never have psychiatry patient need intubation, and one by one they get respiratory distress and require intubation. That alert us. And during the beginning, I actually trying to first of all, when things happen like this, is we want to maintain our healthcare facilities. So I cannot let an airborne disease outbreak in our ward, because that will compromise we need to close the ward. And we are not able to close the ward because we keep on having patients to need admission. So my first thing is actually I take over this patient to my isolation room in my ward, which has been created previously during our SARS outbreak in 2003. That is the first thing that Hospital Kuala Lumpur, being head by Dato' Christopher Lee at that time, that we have started some isolation room in our ward, 5th floor, ward 28 in Hospital Kuala Lumpur. So I actually take all these patients in and isolate there. But what I learned from this mistake is I keep on taking over the patient from psychiatry ward, keep on having new patient in the psychiatry ward. So learning from this mistake, I have then we have a meeting, and finally we contain the outbreak by closing the psychiatry ward. And I just manage all these influenza patients in the psychiatry ward itself. So it's a dilemma that when there is an outbreak happening like this, shall we take over, not to compromise the service, or we actually need to compromise the service by closing down the ward? This is something that very is happening, is potentially to happen in our coronavirus COVID-19 outbreak as well. So coronavirus are mainly transmitted by large respiratory droplets, direct or indirect contact with infected secretion. PPE and good infection prevention and control are effective at minimizing risk, and healthcare worker to infection control procedure as recommended. So PPE is very important because we don't want outbreak happen in our healthcare facilities. So before the vaccination come in, these are the things that very another thing that I'm going through my working experience is when this thing happening, we want even during the outbreak in Hospital Kuala Lumpur for influenza, I always feel that coronavirus and influenza always mimic each other. During this outbreak also, during my investigation, there are 2 healthcare workers actually get infected with influenza B. So the very important is our own healthcare workers shouldn't get infection, because if healthcare worker get infection, it will spread to the ward. So in this learning from this, we are actually very, very cautious with our healthcare worker. So this is a guideline from our Ministry of Health that come out during the COVID-19 outbreak. So it look very complicated. It depends on whether the healthcare worker are likely to get infection or not. It all depends on whether either the healthcare worker is wearing mask or the source patient is wearing mask. As you know, if we are during this outbreak when beginning, we are also thinking that should we ask all our patients to wear masks, because we cannot identify who are the patients coming to our ward with respiratory illness are having COVID-19. Shall we ask all our patients to wear masks or not? Because we know that some patients with COVID-19 are asymptomatic. So it's very challenging. Then we at one time we almost said we should ask all our patients to wear masks. And how are we going to ensure compliance on our patient wearing masks? In fact, we want to ensure healthcare worker compliance. Even me myself wearing masks all the time is also very difficult. I will tell you all honestly, when I work in the coronavirus ward, when I work in the ward being labeled that is COVID-19, I think everybody is very scared, and I can say that my compliance is almost 100%. But when I walk outside my ward, isolation ward, and seeing other infectious disease referral going to the clean ward, all of us will feel a bit suffocated, and sometimes we also not really ensure ourselves can be 100% wearing N90, wearing all these face masks also. So I would say that even in healthcare worker, to ensure our patients to wear masks is almost very, very challenging. So if our patient is wearing mask and we are wearing mask, then the exposure category will be low. This is we want it to be low, because if it's low, if something happens, we do not need to quarantine healthcare worker. As long as if you can see, if we are not wearing mask and if we are categorized into medium risk, then we will in our guideline we said that any medium or high risk exposure, we should quarantine our healthcare worker for 14 days. So imagine if there is some outbreak of cases in our ward, and we can't avoid that our healthcare worker will get exposed, because we work together in the ward. We also sit together in pantry, all that. So if you count back the number of healthcare workers need to get quarantined, it will definitely affect our service. So this is very challenging. Ideally, we should quarantine for 14 days, at least minimum of 8 to 10 days now also, because when something happens now, our experience is we get the first swab to screen our healthcare worker whether he get infected or not. Sometimes it can be negative at first swab and positive at the second swab. So if you want to quarantine all the healthcare worker for this duration, again, the healthcare service will get compromised. So sometimes we have to take some medium route. So we also in the guideline we leave way that a clause that in the event of crisis and staff shortage, return to work may be allowed after a first or second swab are negative. This is what we are compromised, and sometimes we take a bit of risk in doing that nowadays. So you can see that if we are not careful and healthcare worker getting infection, it will cause some outbreak in the ward. This is quite serious. So we need to have some SOP for return to work restriction, and healthcare worker, these are our little guideline that we put out, should be allowed to return to work, and OSHA should be notified, and the healthcare worker need to monitor themselves for symptom of fever or cough or respiratory illness. We need to have staff declaration form to fill in upon return to work. Strictly wear surgical mask all the time in the healthcare facilities, adherence to hand hygiene, respiratory hygiene, and cough ethic. And we need to move. Sometimes we said that if the healthcare worker cannot be all quarantined, there is also a way that sometimes we just innovate ourselves, whether we call it what, we balloon them. So those healthcare workers cannot be transferred out and work in other ward. If you have already exposed in that particular ward, you just can continue to work on that particular ward alone. We are also trying to practice that in the event that we want to maintain our service. So avoid these are some of the ways that we actually trying to do in our hospital. Sometimes if it's necessary to close down the ward is also necessary, or freeze certain cubicle is also necessary. So how we go into talking about vaccine nowadays, and vaccinating healthcare personnel protect healthcare capacity. So given the evidence of ongoing COVID-19 infection among healthcare workers and critical role that they play in caring for patients and continuing protection of themselves at work, at home, and in community remain a national priority. That's why first liner like healthcare workers are priority in getting the COVID-19 vaccine. Healthcare personnel who get COVID-19 vaccine can also spread. Healthcare workers who get COVID-19 can also spread the disease to those they are caring for, as I show you my influenza outbreak in our hospital previously in 2019. Okay. Risk of healthcare worker, risk of COVID-19 is very low in vaccinated medical workers. So one of the things that people are worried now is because despite 2 doses of COVID-19 vaccine, people is still seeing that there are breakthrough infection among healthcare workers, even though you have 2 doses of COVID-19 vaccine already being done. So this article showed that among all the vaccinated healthcare workers, those tested positive for COVID-19 1 or more days after vaccination, 71% of them with the first 2 weeks after the first dose, of the almost 30,000 healthcare workers who received their second dose, only 0.1% tested positive. So it showed that actually those healthcare workers who has completed 2 doses of COVID-19 vaccine, the risk of them getting infection, even though it's not 0, but is very, very, very low. This is also some news from our own local country in Malaysia. There are 40 healthcare workers have been infected with COVID-19 disease, even though they have completed their vaccination. So our DG has said that for among all these 40 healthcare workers who has completed COVID-19 vaccine and yet get infected, 9 cases were infected more than 2 weeks after the second dose, and 31 cases infected less than 2 weeks after the second dose. So the researchers said that low rate of COVID-19 infection in their study 14 days after administration of the second vaccine dose is a hopeful sign and suggests that vaccine remain effective outside of clinical trial. However, the vaccine are not 100% effective. So pointed out vaccine trial efficacy of 94.1% against severe COVID-19 14 days after the second dose for Moderna vaccine and 95% 7 days after the second dose for the Pfizer version. So this data underscore the critical importance of continued public health mitigation measure like wearing masks, physical distancing, and daily symptom screening and regular testing, even in environment with a high incidence of vaccination until herd immunity is reached at large. So even though we know that the transmission risk has been very low, it's not 100%. So even after the vaccination, the public health measure like mask, wearing masks, physical distancing is still need to be practiced. It is clear that we still can be infected after completion of vaccination, but perhaps less in severity. So no one is safe until everyone is safe. So please continue to comply with the 3C and 3W, which is washing hand and all that. So COVID-19 vaccine reduces virus transmission in healthcare worker study. So this is another study just to show you all, because there are a lot of things saying that effect of vaccination on transmission is not great, but this study to actually showing that the study I show you just now is a study to determine the documented COVID-19 cases and hospitalization in unvaccinated households member of the vaccinated versus unvaccinated healthcare worker. So this study, they study the household of the healthcare worker. One group is healthcare worker who already complete vaccination. Another group is household which stay together with healthcare worker who are not vaccinated. They do the study from 8th of December until 3rd of March. So this study showed that household member of vaccinated healthcare worker has a lower risk of COVID-19 compared to households member of an unvaccinated healthcare worker. So this study actually showed that it actually reduced transmission as well, despite some articles say that it's not. So they define the fully vaccinated healthcare worker as any healthcare worker who has completed more than 2 weeks following the receipt of second dose in a 2-dose series, or more than 2 weeks follow the receipt of 1 dose of vaccine in a single dose series. So some vaccine need only single dose. Those defined as fully vaccinated are 2 weeks after the date that they got their vaccine, or 2 weeks after the second dose for the vaccine who require second dose. So in the CDC, talking about if we achieve certain percentage of vaccination, they are trying to actually allow visiting in our healthcare facilities. Nowadays, I feel that I personally feel that I'm sure all hospital or all healthcare institution has limit visitor. So it's actually they are quite distressing for some of our patients that there is no visitor to visit them. They feel more bored, and in fact, when I feel that our healthcare quality is being compromised, because every time I go there and see the patient, especially elderly patient that they cannot give a thorough history, I don't have family member to help me for me to get more history. I need to phone the family member. Whenever there is a certain procedure need to be done, I give you example. One day, the patient query TB, query CA lung, got lung lesion, got some cervical lymph nodes. Then I want to ask for a lymph node biopsy. My patient tell me that, Dr. Leong, can you let me go home, because I have been staying here for almost 1 week and you're unable to tell me what is my diagnosis, and now you want to do a biopsy. He almost crying and said that he doesn't want the biopsy. But imagine previously, before we go into this COVID era, this is where the family support is important. If the family is come together and we explain together with the family, usually it's more easy to get the procedure done rather than no visitor lah. So we hope that after the COVID vaccination, we can go back to allow certain visitors to come in. What's that? Okay. Okay, now the next question is whether we can we need to quarantine for the asymptomatic patient or not after after everyone get vaccinated. So fully vaccinated healthcare worker with high risk exposure who are asymptomatic may not need to be restricted from work for 14 days following their exposure. This is yet we need to discuss among in our policy maker whether we can allow this. This is actually from CDC. They are hoping that with a healthcare worker being vaccinated, we do not need to quarantine them so that they won't compromise our healthcare facilities. As I tell you just now, in my ward, if one patient get infected, there are many healthcare workers, including nurses, doctors, even physiotherapists who take care of patients in that particular ward. Everyone will need to get quarantined. It will actually compromise the healthcare service in our facilities. Work restriction following a fully vaccinated healthcare population with high risk exposure should still be considered for healthcare workers who are immunocompromised. Because for healthcare workers who are immunocompromised, we cannot be comfortable whether they have the immunity or not. So this in CDC, they put this as an exception. Healthcare workers who have traveled should continue to follow CDC travel recommendation and requirement, including restriction from work or when recommended for any other travelers. This is one to ensure that healthcare worker doesn't bring disease from overseas. So they say that even after vaccination, you still need to quarantine if you go visit other countries. Okay, fully vaccinated inpatient and resident in healthcare setting should continue to quarantine following prolonged close contact within 6 feet for cumulative of total 15 minutes for more than 24 hours period with someone who are confirmed COVID-19. Outpatients should be cared for using recommended transmission-based precaution. So despite all the vaccination, if there is one patient in your ward that is positive, the contact of that particular patient is recommended to be we still recommended to freeze the ward or quarantine the patient who are in close contact. This is also we want to prevent transmission, prevent outbreak. So, but at the bottom, they say quarantine is no longer recommended for residents who are being admitted to a post-acute care facilities if they are fully vaccinated and have not had prolonged contact. So those who are not having prolonged contact, they can probably has a discount not to be quarantined. But those who are having close contact despite vaccination, we still want to quarantine and isolate them. Talking about this is something interesting. Someone, a lot of colleagues has asked me whether after everyone get vaccinated, should we still do COVID-19 testing? And in the CDC recommendation, they said that recommendation for COVID-19 testing for healthcare workers, residents, and patients remain unchanged despite vaccination. So for healthcare worker, if you are despite that you are already fully vaccinated, if you have contact for more than 15 minutes, less than 6 feet around surrounding, you still recommended to do a COVID test screening, because we know that vaccine is not 100% protective, and we do not the implication of healthcare worker getting infected and transfer the disease to other patients is high. So despite you already having vaccinated, is the screening, the COVID-19 testing remain unchanged. So same also, my colleagues also asking me, after I got COVID-19 vaccine for two injection already, I'm protected. Is it okay or not to screen my patient? I just continue to do my procedure and all that. CDC recommend that COVID-19 testing is still needed. Use of personal protective equipment. So recommendation for use of personal protective equipment like wearing PPE, wearing face mask when seeing patient is still remain unchanged, whether you vaccinated or unvaccinated. This is also a current CDC recommendation. So I think that's all from me.
Doctor, thank you so much. I think what you've given us is very, very concise, and good that you've kind of stratified very clearly for us healthcare workers what are the kind of current guidelines and how it's applicable to us, Doctor. Thank you so much. Okay, so please allow me to join me actually in thanking Dr. Leong for his very insightful presentation. And I'm just going to get Prof Victor now to actually cover his segment of the talk. And as Prof said, let's do the questions together right after. Prof, over to you, Prof.
Thank you very much, Murali. So basically, I will continue. All right. So I think my topics is somewhat the same as what Dr. Leong presented. So good afternoon, everybody, and thank you for inviting me here to this webinar. I'm always very, very happy to be joining the webinar from the Public Health Society of Malaysian Medical Association. All right. So thank you, Murali, for inviting me. So the topic that Murali has given me is after COVID-19 vaccine, what is next? So this is MMA InfoVax, a dose of truth. So I'm Prof Victor. I'm basically from the Department of Social and Preventive Medicine, Faculty of Medicine, University of Malaya. All right. So I think everybody knows what is novel, what we are dealing with. So we are dealing with the novel coronavirus. Cases first reported in Wuhan, China in December 2019. And the first case actually came to Malaysia on the 25th of January 2020 from a tourist who's coming from China but coming from Singapore. All right. So before we start, of course, I think Dr. Leong have actually explained what you mean by risk. So basically, we know that the virus is spread by droplet and aerosol, and almost 85% of the population of the people actually are asymptomatic. So that is important. All right. And when we talk about control of COVID-19 vaccine, we also focus on the basic of three levels of control. Basically, it's primary prevention, secondary prevention, and tertiary prevention. Secondary prevention is early diagnosis and treatment. Tertiary prevention is basically prevention of complication. And of course, we want to prevent the disease, prevent from getting the disease. Basically, we're focusing on primary prevention. So primary prevention includes personal strategies like what Dr. Leong have actually said, social distancing, wearing of masks, and also hand hygiene, and also environmental strategies like basically avoiding crowded places, avoiding confined spaces, and also ventilation. So ventilation is a very important component of primary prevention, which is basically have not been covered very extensively, and a lot of people don't understand what is the importance of ventilation. And of course, quarantine is also a primary prevention. Basically, quarantine is contact tracing and identifying people who have a contact with COVID-19 patient and just quarantine them either in the quarantine center or at their home. And the last is basically focusing on the vaccine. Since we're talking about vaccine, and I think the vaccine actually have come to Malaysia already. All right, and most of the healthcare workers actually have received their vaccine, and that is very good. Congratulations on all those who have received their vaccine. I have received my vaccine. I have completed my second dose, and I have no problem with my second dose. But some people do have problem with second dose. Of course, we know that there's 4 types of vaccine, COVID-19 vaccine that is basically currently available or currently under development. There's nucleotide acid vaccine, there's protein subunit vaccine, vector vaccine, and whole virus vaccine. Of course, the one that we are taking basically is Comirnaty, or the Pfizer vaccine, is the nucleotide vaccine. And protein subunit vaccine includes Novavax, and vector vaccine is Johnson & Johnson, AstraZeneca, Can, Sino Biology, and Sputnik V, the Russian vaccine. So we are getting the Russian vaccine, and the whole virus vaccine is basically, this is killed virus vaccine. It's not live. It's not attenuated. It's basically killed virus. Basically, Sinovac and Sinopharm. So Malaysia will be getting the Comirnaty, the Biology, the AstraZeneca, the Sputnik V, and the Sinovac. So these are the vaccines that we are going to be receiving. And of course, we are now having the Comirnaty and the Sinovac being administered to patient and also to a healthcare worker who are frontliners. So I think Dr. Leong actually presented this, but this is just to summarize it in a more concise manner. So what's a vaccine efficacy in real world scenario? So 14 days after fully vaccinated, so 90% in USA, 90% of among healthcare worker, the protection up to 90%. In the UK, 89% of adults over 80 years old. In Israel, 97% of general population. And after 7 days of fully vaccinated, basically 2 doses, as mentioned at the 2 dose of the 2 dose series, or 1 dose when we look at the Johnson & Johnson, basically we need only 1 dose. So in the USA, basically we're talking about 89% among general population, and UK 86% among healthcare workers, Israel about 94% among general population, and Denmark 64 to 90%. So from the real world data, we understand that the vaccine efficacy is basically around 80 to 90%, which is basically is considered very good. And although basically if you do get the vaccine, if you do get the infection after the vaccine, your chances of getting severe infection is basically very low, and most of the 89% of people who basically develop the infection basically have low severe COVID, and that actually don't require any hospitalization. So there's efficacy against death also. Basically, there's 0 death for people who basically have received the COVID-19 vaccine. So that's important to consider. Basically, you must understand that the vaccine is really might not prevent you from getting the disease, but it actually prevents you from getting severe disease. Basically, prevents you from getting getting mortality based on the disease. So COVID-19 vaccine may also protect against asymptomatic infection. So these are the current findings that basically it shows that COVID-19 vaccine protects against asymptomatic infection. So as mentioned by Dr. Leong earlier, basically when you talk about when you consider yourself fully vaccinated, it's 2 weeks after completion. So you must understand that although you have taken the vaccine today, the vaccine needs around 2 weeks to be basically to stimulate your immune system for them to produce antibodies. So that's important. All right. So for a 2 dose series, a 2nd dose. For a single dose series is 1 dose series. So what's next? So what is the post-vaccine scenario in Malaysia? So use of PPE and other risk mitigation measure in the workplace. I think Dr. Leong actually highlight this, that although people has been vaccinated, you need to continue to use your PPE protection. And I think the important thing that you need to use PPE all the time. All right. Doesn't matter if you're breathless or not. Basically, if you're breathless, if you need to take out your mask, please take it off when there's no one around, because we want to protect the workers in the workplace. And we have a lot of experience on managing COVID-19 among healthcare workers, especially in the University Malaya Medical Center. So by following strict SOP, basically we prevent hospital transmission. So hospital transmission among our healthcare workers is basically very low. So out of the 200 cases of COVID-19 infection that we got in up until March of this year, only around 10% of them basically are due to transmission within the hospital itself. And this is transmission during not within hospital, but transmission during patient care. And this is basically only when they are working in a non-COVID ward, when basically they don't know that the patient is a COVID patient. So that is what is important. We understand from practicing from the many years of experience with HIV that universal precaution is the thing that we need to continue. And I think that that is important. We must make we should not look at what type of patient that we see, but more important thing is we should consider what type of procedure that we do, and the PPE should basically be consummate with what type of procedure that we do. So that is something important, and that is something that you need to focus on. So should healthcare worker change any practices? Currently, we don't recommend any changes of practices. Basically, we advise you to continue to practice what SOP that you have been taking into consideration, and continue to practice those SOP. This is we are talking about when I'm advising you here, I'm advising you from the context of healthcare worker within the healthcare setting. All right. If you are a healthcare worker and you are basically with your family and your friends, all right, the CDC recommendation is very simple. CDC says that if both of you are vaccinated and both of you basically have completed 14 days of vaccination, there's no need for you to wear masks when you are basically with each other. The same thing that if you're fully vaccinated, there's also you can consider to go and for visitation. So that is what the recommendation by CDC is concerned. The next is screening of post-vaccinated patients. Should it be done? As highlighted by Dr. Leong, yes, we still need to screen post-vaccinated patient. But what type of patient are we talking about? Basically, we are talking about patient that is coming for procedure. All right. We are only focusing on patient that's coming for procedure. Procedure means that surgical procedure that we are more concerned about. And of course, patients showing sign and symptom of respiratory illnesses, that's where we need to screen the patient. So in the University of Malaya Medical Center, we don't routinely screen patient before we admit patient into our hospital. And even for surgical patient, we do the RT-PCR, and we don't do the RTK antigen. The reason for doing the RT-PCR is basically for us, for surgical patient, is not because we want to protect the healthcare worker, but it's more to protect the patient, because we know that when you have COVID-19 and when you go under general anesthesia, your outcome will be worse compared to worse. So if it's possible, basically we'll postpone any surgical procedure, especially elective surgery, until after the patient actually have recovered from the COVID-19 infection. So that but no matter whether you have COVID-19 or don't have COVID-19, when we are doing any procedure that's aerosol generating, the healthcare worker continue to practice using the correct PPE based on the procedure that they're doing. So the next is primary healthcare setting. Should any risk mitigation practice change with vaccinated workforce? And again, there shouldn't be any change in the practice when you talk about vaccinated workforce. The only thing that you can change is, as I highlighted, is that when you are not in the healthcare setting. When you're in the healthcare setting, you need to continue to follow the SOP, and continue to wear the PPE, continue to have social distancing, and continue to observe hand hygiene. And the PPE should be based on the procedure that you're doing, and not based on the patient that you are seeing. So to conclude, basically the strategies to control COVID-19 vaccine, we still have to continue our personal strategy. We need to also improve our environmental strategies, basically our ventilation within our hospital, our ventilation within our ward. So those are the things that I think a lot of hospital has not taken that into consideration because of lack of understanding of what is important about air circulation within the hospital compound. And of course, early good contact tracing and quarantine, and of the vaccine, if everybody should continue to take vaccine. So we must continue hand hygiene, face mask, social distancing, and ensure cleaning of surfaces, avoid crowded area, avoid confined spaces, and avoid close conversation. Thank you very much. Thank you, Murali. I hand it back to you.
Thank you so much, Prof. I think very aptly kind of drawn out for our colleagues. So, ladies and gentlemen, I really hope that this has been helpful in terms of covering back these lot of questions that we've received, both in terms of MMA, Facebook queries to MMA colleagues, as well as in various social media channels. What we would like is, if you continue to have questions, kind of put them into the chat box. Prof and Doctor, if you're okay, if we can take some questions, that would be lovely. Thank you so much. If Dr. Leong is there as well, Doctor?
Yes.
Okay,
yeah.
Lovely, Doctor. Doctor, I think this one, the first question I'm going to put forward to you. This one, one colleague is asking, how do you determine how much antibody or immune response we have developed after 2 doses of vaccination? And there's like a pooled kind of follow-up question. Is it necessary for us in the future to actually do antibody testing to determine whether we need to up booster doses? These 2 questions, Doctor.
Okay, yeah. How to determine whether you have enough immunity after 2 doses of vaccination? There are trials going on, but it's not available as a routine. IMR has trial going on to measure neutralizing antibody for people who has completed 2 doses of vaccine. Yeah. Whether we should check immunity after vaccination, I feel my answer is I don't think it's widely available and is quite costly. So I think back all the other vaccine that we get our vaccination, I think none of them I'm aware that actually people are checking antibody.
Right, Doctor. And I'm reminded also actually of your hepatitis B booster shots. That very rarely we actually look at antibody titers. We just give the booster anyway.
Yeah, but for hepatitis B, if you really want to check, yes, that is available, because hepatitis B, we need to know that your titer shouldn't be less than 10. If it's less than 10, then it's not protective anymore. So until then, unless the neutralizing antibody facilities is available, like what the hepatitis B antibody is available, theoretically, yes, we can check. But whether we need to check or not, it depends on how costly is checking lah.
Right, right. And that actually brings us to the next question, which I think I'm going to ask Prof to kind of fill this, Prof. And that kind of ties into the question from Dr. Leong, which is currently how long does the available vaccines last in terms of efficacy, Prof?
Currently, our recommendation is that 3 months after, basically you're considered fully immune after vaccination, because this is the recommendation by the CDC. So after we basically, maybe in the next 1 or 2 weeks or more, when new evidence comes out, it might be extended to 6 months. Then at 6 months, it might be extended to 1 year. So the information is very simple, because the vaccine is very new, the virus is very new. So the available research data is still very limited. Although we know that there is basically immune already, but we don't know how long the immunity lasts, and we don't know how long the immunity in the body lasts. But there are studies done earlier that shows that people who basically get a COVID-19 disease, their immunity basically lasts around 6 months. So that may be a thing that we might consider. Most probably we'll need a booster dose every year, just like our influenza booster dose.
Right. For you, ladies and gentlemen, who are kind of want to be a little bit more aware of how this is actually done, basically these living cohorts are those people who have been vaccinated, and now every month they're actually checking their antibody titers to see how long they'll last. And I think this has been done for each vaccine, right, Prof, separately?
Yes, this is basically been done for each vaccine, and Malaysia also we are also doing it for our own population. All right. Okay. And if those that have not been vaccinated, all right, have not started your vaccine, if you want to get some money and get tested, there are few research going on that they will pay you around 300 ringgit for six times of your blood.
Ah, right? Okay.
So one time before you get vaccinated, then after, I don't know how, until 3 months after you get vaccinated.
Right, will do, Prof. We would really appreciate it if we had the link for where to sign up, lah.
I basically, if you want me, I can ask my colleague to actually give you the link, but my colleague is the one that is doing the research.
Lovely. That'd be really helpful, Prof.
Yeah, but only for those that have not been vaccinated, like yes. for me and for Dr. Leong, we cannot join the test. We cannot join anymore because they want to know whether you have actually how the vaccine actually works.
Yeah, that's right. Unfortunately, neither can I now.
Yes. 300 ringgit is good money for makan, I think.
Exactly. At least you can go a nice seafood dinner. Dr. Leong, there's one question, Dr. Leong, and this is on post-vaccination enlarged lymph nodes about 3 cm times 3 cm. When would a lymph node biopsy be needed, and what would be the general approach to patients or colleagues who experience significantly enlarged lymph nodes after completing the COVID-19 vaccination of 2 doses? Any thoughts, Dr. Leong, on this?
Okay, this is a challenging question. Other than BCG that can cause enlarged lymph nodes, I'm not aware that actually COVID-19 vaccination will cause enlarged lymph nodes. But no doubt, because this is a new vaccine, any sign and symptom we need to be collected as a AEFI. I will say that we collect this as a AEFI. Whether the enlarged lymph node can be attributed to the COVID-19 vaccine, I'm not sure. So if you are asking me about this question, I'm not more common income first. I won't think about it is due to your COVID-19 vaccine, even though I cannot deny it may be. But I will say that the common income first, if unlikely due to the COVID-19 vaccine, I will just investigate you as anybody with enlarged lymph nodes, and commonest in Malaysia is still TB or lymphoma.
Right, exactly, doctor. So you would say when you're listening to what hoofbeats, think horses lah, not zebras, not yet. Yeah. Well do, Dr. Leong, I think this one also I wanted to ask you whether you could weigh in on this. And there are some stories, I'm just reading verbatim, Doctor, there are some stories circulating about deaths following vaccinations. Prof, later I want you to also maybe give us some insight on this as well. One was a 36-year-old supposedly healthy MLT in Pahang. Any truth in it? And more importantly, how do we message to fellow healthcare professionals to reassure them and convince them, look, go out and get vaccinated, and also kind of promote vaccination to other members of the public?
Yeah, again, I will say that all this death is quite serious. So if it's really due to the vaccine, it's quite serious. But being said that, again, we need to treat anything as a AEFI first and investigate. I will not say that the death, same like I mentioned just now, enlarged lymph node I never heard is due to vaccine. Even death also very unlikely. Even I think I seldom heard of any vaccine can cause death anyway. But because of the thrombosis and all that are actually being discussed and hot in the pipeline in European country and all that, we won't denial, but I will say that again, that are very, very low. And even that also, there are investigators saying that the death may not be related, and anyone, first of all, I need to know whether the age of the patient. I don't know what is the age of the patient. If you are giving vaccine in elderly, maybe it's also time for them to go. But you just because they are going, they are going after the vaccine, then you attribute it because of the vaccine where it is not. So I still will say that our public shouldn't looking at 1 or 2 deaths and then go away from vaccination. You should also see that how many patients, maybe you should invite them to come to my ward and see how many patients having COVID-19 ended up with organizing pneumonia, and eventually how they suffer after even 3 months, they got reduced effort tolerance. So if a vaccine can prevent you from getting organizing pneumonia, and how many patients has died from vaccine?
Right, right. I think that's a very important point, Doctor. Thank you for making that. Prof, could I get you to weigh in as well, Prof?
Thank you very much, Murali. I think I look at it from a different perspective. Basically, from a public health perspective, anything that is severe, we need to basically we know that fear is very easy to sell, and that is important. So we cannot just deny that the thing is basically not due to the vaccine, but looking at it, basically, as Dr. Leong mentioned, that is basically coincidental death, and we need to investigate further. And until the investigation has been completed, we shouldn't make any conclusion. But as Dr. Leong said that for thrombosis, I don't think we have any history of thrombosis from the Pfizer BioNTech vaccine that we have been receiving now. So thrombosis would not be the problem. But the main thing is, how do we reassure the public is that I think by reassuring the public is that first thing, the healthcare workers should get vaccinated, and after getting vaccinated, they should tell the truth of what really happened. All right. So some people have very bad second dose experience. Some people have good second dose experience. I'm lucky that I have good second dose experience. I got no problem. A lot of my colleagues, some of my colleagues basically have very bad experience. They suffer for 32 hours to 48 hours. Basically, it's just something like your very bad flu, but that's okay. Basically, that's normal. It shows that the vaccine is working. So the thing that I am afraid of from my side is that because I don't have reaction, whether my vaccine is working or not. So that is also something that you need to worry about, because we know that when the vaccine works, basically it reacts and the body reacts and there's a reaction to it. And when there's a reaction, you basically get fever. So that's normal.
Yeah. I have the same concern as you, Prof. I basically had my first dose, had absolutely nothing, and now I'm concerned whether immunity was actually stimulated or not.
Yeah, true, correct. Maybe our immune system does not work, you know.
Yeah, Dr. Leong, there's another question, Doctor, for you. This is on what happens to a asymptomatic patient. I'm assuming they mean somebody's having COVID-19 but asymptomatic, and if he ends up going for his or her COVID vaccination, will there be a flare-up of disease?
Definitely not, I will say. Vaccine will not flare up asymptomatic. Because looking at if you are asymptomatic, means usually asymptomatic happen in a more younger patient. If you are asymptomatic, it means that those patients who have symptoms are actually hyperinflammatory response. But I never see any vaccine recorded. Have been so many vaccines has been given over the world. There is none reported. Nothing has reported that vaccine can mount hyperinflammatory response. So how can a vaccine causing a more turn a patient from asymptomatic become symptomatic?
Right.
Yeah.
Okay. Thank you, Doctor. Very, very enlightening. Prof, another kind of epidemiology.
What is it, darling? The car is far away. Relax.
I'm sorry, gentlemen, ladies, could we kindly mute your videos and audios? Thank you.
Param Singh. Yes, thank you, Param Singh.
Okay. Prof, this is another kind of epidemiology question. Okay, Prof, any insights on actually why did COVID vaccine efficacy threshold, why was it set at 50% by WHO? Why not more than 70%, for example? One of our colleagues asks.
Basically, if you look at the current vaccine that we are having, it's basically higher than 65%. All right, and the main one is even 90%. So the threshold was set as 50% is because of the urgency of the issue and the time is basically if you look at the efficacy of the vaccine, you must understand that efficacy of vaccine depends on a lot of things. That's why a lot of different vaccines have different efficacy based on not because of the vaccine itself, but because of where the test is basically being done. All right. So in the US, where the test is basically being done when there's a high number of patients, all right, who is positive, so you can actually get a better result compared to when there is no patient because there's positive. That means your prevalence in your community is high, then you can actually have a better result of whether the efficacy is there or not. But when your prevalence in the community is low and the vaccine is being tested here, it's very difficult for us to basically get the correct number, because when you talk about efficacy is that the patient must get, the vaccinated person or non-vaccinated person must get a COVID-19 disease. So that is why I think WHO has set at 50% because of the current situation that we are facing in the and it's very uncontrolled situation.
Okay, got it, Prof. And I think also, Prof, could you also kind of weigh in on how the effectiveness evidence has kind of come out now? Kind of after these clinical trials, now that you're testing it in the real world, does it seem to be as robust, the kind of evidence?
Yeah, basically the evidence from the real world is almost the same as the evidence from the studies itself. Most of the vaccine basically shows around 80 to 90%, or some even 97% efficacy. So I have presented I presented data basically on you're talking about 2 weeks post-vaccination in Israel, USA, and in UK. All right, so it's between 85 and 94% efficacy. So that is basically shows very good. But looking at that data alone is not very impressive. Now you want to look at what happened in the UK. All right, the UK have a lot of cases. I think around few thousand cases before the vaccine start, and now basically the cases have come down to around 2,000 after the vaccine have started, because they have basically covered a lot of people already. They have covered, I think, around 65% of their population, and those who at least one vaccine, and those who are basically over the age of 80 years old, they've covered almost 95% of their population. So basically they have covered a lot of people already in the UK. And the UK variant is, of course, much more effective compared to the other variant. So from the UK study, we know that the vaccine actually works.
Yeah, and I think that's the other kind of good thing coming out of it. Although these vaccines they didn't advertise the fact that they can actually stop community transmission. We're actually now seeing that, right, Prof?
Yes, correct. We have seen the stop of transmission, all right. But the main thing is that we must ensure that everybody get vaccinated as fast as possible, because we know that there are a lot of pockets, and as Dr. Leong last slide put it that unless everybody is safe, no one is safe.
Yep, exactly. Dr. Leong, one more question. I'm just going to take a few more questions. I'm sorry, all of them seem to be quite important for our colleagues. Dr. Leong, there's one on, are there any concerns in giving COVID-19, the Pfizer-BioNTech vaccine, to patients with underlying heart disease? There seems to be a growing concern among the general population. I think this one from one of our primary care colleagues about their patients with heart disease, and they're concerned that the vaccine will have some kind of repercussions on them. Any sharing or insights to provide, Dr. Leong?
I'm not aware of any concern of heart disease. As Prof Victor mentioned, if we talk about thrombosis, it's not a mRNA vaccine anyway. So I don't see any concern giving mRNA vaccine on heart disease. Unless the patient has what he means heart disease, unless the patient has one concern is unless the patient has atrial fibrillation and on warfarin. If his atrial fibrillation on warfarin and his INR is not well controlled, he go and get the vaccine when the INR is beyond 4, he may get easy bruises. That's all. Other than that, if your INR is well controlled, and I don't see any reason.
Right, and I think that's a very good kind of line from Dr. Leong, which I think is worth kind of sharing, which is patients who for you seem to be, for those of our colleagues in primary care, if your patient seems to be not well controlled, I think better to seek a specialist opinion. You know, and wouldn't that be a safer way to go about it, Dr. Leong?
Yes, you need to get your INR control before you get the vaccination. Otherwise, there is no contraindication for you to get COVID-19 vaccine. And in fact, a patient with underlying heart disease are more important to get a COVID vaccine, because otherwise, I'm sure all the clinicians will agree with me, especially heart disease and also patient with end-stage renal failure. You easily get heart failure and overload, and then you come in with something COVID-19 and overload. Is it overload because of congestive heart failure, or are you having organizing pneumonia with COVID-19? Then we have difficulty on differentiating. And if you have that, you are and all these patients are also higher risk of getting severe COVID-19 as well. So more important that patient with heart disease to get COVID-19 vaccine.
Yeah, right. especially those with end-stage renal failure, when they need to do what call that? Dialysis. They need to come to the hospital every time, and they need to be exposed to a lot of people.
Yes. Yeah.
So
yeah, correct. What Prof Victor said is exactly correct. We have outbreak in nephro ward that on and off they got cases there, and then it become a palpitation for us how to control the patient in the nephro ward.
Correct, because they come from outside, you know, and they communicate with patient inside, so very difficult.
And then after that, the nephro nurse getting COVID also, and then even more.
Correct. So I think vaccination is important.
Yep. I'm going to take one last question, doctors, and I think this is also, I think, to both of y'all. This is actually from a colleague who's giving us a real world problem, and he mentions that he has one elderly staff in his clinic who has refused vaccination while all his other staff have been vaccinated. The question is, what is the implication to my practice if this unvaccinated staff contracts COVID? Is my clinic responsible for those patients that have been exposed? I'm wondering what can be done, any insights, thoughts, solutions. Again, ladies and gentlemen, this is really opinion of experts, but it doesn't constitute a legal opinion, yeah?
All right, so let me start. Basically, it doesn't matter whether you're vaccinated or not vaccinated. All right, we have been with COVID-19 for the past 1 year. We understand that some people get the disease from the community, and basically they will come to hospital and they continue to work as a healthcare worker. But we almost advise everybody that even though you're vaccinated, you're still, when you are in a healthcare setting, even clinic, hospital, or any healthcare setting, you need to continue to practice SOP. If you continue to practice SOP, there's no risk of transmission. As Dr. Leong pointed out, if you are wearing mask, I'm wearing mask, and I'm not doing any AGP procedure, me and Dr. Leong basically are not going to be at risk, because both of us are wearing masks. We are not doing any AGP procedure. We are just in the same room, so there'll be no problem with that. And I think if you're talking about a GP clinic, there shouldn't be any AGP procedure. And wearing just a mask itself and a face shield, then is adequate. If you're worried about the person, you ask the person to wear a mask and a face shield and ask him to continue to work. Make sure he has observed hand hygiene. Those are the important things that you need to do. But it's better for you to convince the person to basically get vaccinated. I think vaccination is not just for, you must understand, vaccination is not for me and for you or for Dr. Murali or for Dr. Leong. It's for my family. I go home every day. At least now I feel better that I'm not going to bring COVID-19 back to my family. Last time, every day after hospital, I go home. I don't know whether I'm going to bring it back to my family, my mother, my kids, you know, my wife. So it's so stressed up, you know. But now at least I know that the risk of bringing back home is no. So that is important. That you need to communicate with your people who basically don't want to get vaccinated. Right. Dr. Leong, sorry.
Yeah. I think Prof Victor has said most of the thing. I totally agree. Yeah. If the person is if he refuses, we need to encourage him to get vaccinated. As Prof Victor said, it's not for himself, it's for his family, for everybody. So, but if let's say he is got if let's say he has allergic to certain thing and he's contraindicated, then not getting vaccinated doesn't mean that he will bar from work. So as long as you practice all the social distancing, wearing masks, all that, you will not transmit the disease as well. But at the bottom, we need to encourage him to get vaccinated, because that's the way to go to protect everybody.
Right. Well, do Doctor, I'm really sorry. I'll just take one more question from you. Is that okay?
Yeah.
Okay, Doctor, this is on, I think, from another colleague. He asks, there are quite a few patients visiting us to ask whether they should delay their surgical interventions until they've got their vaccination. If so, I mean, what should be the kind of advice we should give them?
What is the reason that person want to delay the surgical intervention? Because until after vaccination. If he got post-COVID, he want to delay, I can understand, because he worried about complication like embolism, organizing pneumonia. He may not, he may want to delay further because of organizing pneumonia. But vaccine doesn't cause you to have any complication. So why should we delay surgery? I couldn't see a reason why he want to delay surgery.
Oh, got it, Doctor.
I think coming from that patient, basically the patient are worried that surgical procedure might lead him to get COVID-19. But we know that our surgical procedure, basically we practice good practice, because there's no risk of getting COVID-19 from a surgical procedure, and we have not get any COVID-19 from a surgical procedure.
Yeah, so, exactly. Yeah.
So don't have to worry. But if your patient is worried and your patient have money, then just go for surgical procedure and go to single room. Then definitely you won't get it from the other patient.
Yeah, looking at that perspective, yes, agree. Majority of the hospital are actually screening everybody anyway, so he won't get COVID-19 from in the hospital lah. Yeah.
Because before you do a surgical procedure, especially in the surgical ward, we need to screen you, because under GA you need to do RT-PCR. Yeah, that's important, because we want to ensure that you don't have COVID-19. Once you have COVID-19, we will not proceed with the surgical procedure. We will not proceed with general anesthesia, because it will lead to a very bad outcome.
Right. Okay.
I think Dr. Leong agreed with that, correct?
Yes.
Correct. In fact, I'm more concerned about screening all these procedures. Screening all the patient pre-surgery will delay some of the patients who need early surgery. They get delayed. I'm more concerned on that rather than another patient worried of the other way around, worried of himself getting COVID-19 procedure.
But I think our testing is very fast lah. Within a day we get the result.
Yeah. Okay. So
okay.
Prof and Doctor, thank you so much. I think there was a last statement from one of our colleagues about can Prof Victor and Dr Leong propagate the get vaccinated as soon as possible paradigm to the public. Ladies and gentlemen, as much as Prof Victor and Dr Leong are doing that to y'all, y'all are really our ambassadors. We need the medical fraternity to go out there and push our colleagues, members of the public, our patients to actually get vaccinated. And that is exactly why we need to equip you all with the best knowledge, so you all can do that advocacy and kind of selling.
By leave.
Yep. Before I kind of bring the session down to a close, could I get Prof to maybe leave us with one or two takeaways, Prof?
The main thing is I think everything has been spoken by Dr Murallitharan already. Just make sure that you get vaccinated. All right, and encourage your patient to get vaccinated, because the more people get vaccinated, the earlier we can return to normal. Please, I think everybody is tired already of the COVID-19.
Yeah, thank you so much, Prof. Dr. Leong, could we get you to have some words to kind of wrap up our segment, Doctor?
Yeah, I will go back to my very first slide that what I faced and I experienced before. If we don't get vaccinated and healthcare worker get infection, or any one of us get infection, our healthcare facilities will get collapsed. You remember my first slide on publication on the influenza outbreak in our psychiatry ward. You really need to close down the ward, and you may have no hospital to go if our hospital get collapsed and everybody get COVID-19. So get yourself vaccinated, encourage everybody to get vaccinated so to maintain safe.
Right. So, ladies and gentlemen, thank you very much. Thank you very much, Dr. Leong. Thank you so much, Prof Victor. And with that, we'll bring this session to a close. And the session will be up back again on the MMA website, as well as the MMA Facebook shortly after this, for you to rewatch for your watching pleasure. Thank you so much and have a wonderful weekend. This is InfoVax signing off. Goodbye.